Hey guys, so in this video we're going to go over the anatomy of the respiratory system. As I go through, I'm going to kind of chat about each section of anatomy, go over some physiology when relevant. Just know that although I'm only labeling the blanks here, you are still responsible for any comments made on physiology when it comes to quizzes and tests. So I highly recommend that you're also taking notes as you watch this video and not just skipping through to get the labels. So let's go ahead and start with this overview diagram. I'm going to go a little bit out of order just because I think it makes sense if we go in order as if we're following the pathway of air. Looking at E, we've got the nose and nasal cavity here. Keep in mind the nasal cavity is going to be the first step of humidifying and warming the air that's making its way into your system. From there, we're going to move to A, which is showing the pharynx. And this is going to be a shared region of both digestive and respiratory. So this is not the last time that you're going to be seeing the pharynx. I'm going to jump over to F because this is our larynx. While a lot of people get pharynx and larynx confused, just keep in mind that larynx, which is your voice box, has to do with language. So larynx, language, it's your voice box. Okay? And then from there, we make it to B, which is the trachea. Okay, and this is something you've seen in both our rat dissection and mink dissection. Kind of looks like a bendy straw, but it's pretty rigid. From here, both of the primary bronchi and the bronchial trees are blocked by the lungs here. So this image is just showing the right and left lungs. And then right here at D, this is showing the empty region of the cavity. The lungs in this image are not fully inflated. Reason being, this is going to show you the pleura. Remember, you have a double membrane here. The membrane that's lining the lungs is called the visceral pleura. Sometimes it's also referred to as the pulmonary pleura. We then have another membrane lining the thoracic cavity, which I've drawn here in blue. And in between these two membranes is fluid. That is going to allow the lungs to glide when you have inhalation and exhalation, so that way we don't get any friction, because there is a lot of movement going on, whether you have skeletal and musculoskeletal movement just from your body, or the movement from inhaling and exhaling. And lastly, there we go. Lastly, H here is showing our diaphragm. Excuse me. And as the diaphragm contracts, it's going to flatten out, kind of like across, and that's going to allow inhalation. When it relaxes, it's going to go back into this umbrella shape, and that's going to force air out for exhalation. Okay? So that's it for this diagram. Let's go ahead and move on to the next one, which is the larynx, trachea, and lungs. Okay? Again, a little bit out of order when it comes to the labels, but I'm going to go ahead and just kind of follow the pathway as we label these. Okay, so to start off, we're looking at D, and D is showing us the thyroid cartilage. It's not pictured here, but this is where the thyroid gland is going to rest against. And below that, at E, we have what's called the cricoid cartilage. If we hop over to A, we have the trachea. And then now that we've got kind of the lungs cut away, we can finally see the primary bronchi. And that's where the trachea branches off into what we call the bronchi, or bronchus if you're talking about just one. If you've ever had bronchitis, that means that you had inflammation in this region of your lungs. And so F is looking at the left primary bronchus. And B is looking at the right primary bronchus. Okay, and then down here at the bottom, we're just labeling right and left lung. So we've got the right lung and the left lung. Good there? Think so. Okay. Let's go ahead and focus on these individual regions now that we have gone over in the overview. So in our original overview, we talked about the nose and nasal cavity first. So let's go ahead and talk about them individually. Okay. So looking at the top diagram now, we're going to go through and label these features here. A, which is kind of like the bridge of your nose where your eyeglasses sit. This is your nasal bone. And to be perfectly honest with you, I'm not sure why. This area is called the frontal process of the maxilla, even though it's actually quite close to the lacrimal. But we're going to stick with the label according to the reading here, as you can see right there in the reading where they refer to that. Oops. Okay. From there, we have a couple different cartilage sections. C, we're looking at the septal cartilage. So the septal cartilage, we'll go over this in the next one, is the cartilage that's going to extend off of the perpendicular plate and kind of separate between left and right sides. From there, we've got D, which is the lateral nasal cartilage. And then below that, we've got the cartilage that's kind of on the side of your nostrils. Excuse me. This is called the lesser alar cartilage. And then the cartilage that kind of makes up the bulby part of the tip of your nose is called the greater alar. Now, the lesser and greater alar cartilages, I guess that's how you say it plurally. I don't even think plurally is a word. But anyhow, when it comes to the lesser and greater alars, these are going to continue to grow throughout your lifespan. So this is why sometimes you see older individuals who have very bulbous shaped noses. It's because that cartilage is going to continue to develop throughout your lifespan. And then lastly, what we refer to as our nostrils are called the external nares. Okay. Let's go ahead and move on to the diagram just below that. If you recall in the skeletal unit, when we did the inside of the skull, there's kind of a bump just below where the frontal lobe of your brain would sit. It's referred to as the crista galli. And surrounding the crista galli was bone that kind of had little holes and pockets in it. Almost looked like a sponge. That area was called the cribriform plate. And we actually mentioned the cribriform plate when we talk about olfaction, because as you can see, the cribriform plate is going to be kind of against the nasal cavity. This is going to allow connections to be made from the frontal lobe. So if this is our brain resting in here, right? It allows connections so that as air makes it into the nasal cavity and chemicals are dissolved into the mucus there, it can cause stimulation and send a stimulus up to the brain, to the olfactory bulbs, so that you can distinguish what you're smelling. Moving on from there, again we have the nasal bone. Okay, and then here at J, this is what I was, oh, that was rough. This is what I was talking about earlier. This is the perpendicular plate. Okay, this is what that, oh, sorry, I don't know if you could hear that on the microphone. Buford was scratching his collar. Anyhow, this perpendicular plate is where the septal cartilage is going to extend from. So this here is our septal cartilage extending off of the perpendicular plate. All right, and then just below our perpendicular plate we have the vomer. This was a portion of the skull that we were able to see on the inferior side when we studied the skull. Again, we have the greater alar cartilage, which is the bulby part of your nose. Here, I'm going to color this in. This is the anterior portion of the roof of your mouth. That means it's your hard palate. And then as you extend past the hard palate, you have the soft palate. This portion of your palate, depending on the spacing, especially however you're positioned at night, that if it rattles back and forth as you inhale and exhale, this is what's going to cause the snoring sound that people make. And then lastly, right here, here's where we have the connection between the nasal cavity and the pharynx. These are our internal nares. So this is essentially how we can get air going from the nasal cavity down into the throat. Let's go ahead and move on to our next diagram. This is going to show us the wall of the nasal cavity, and then we're also going to take a look at the epithelial lining of your nasal cavity. So again, we're going to start off with the nasal bone. And then we're going to look at this structure here, which is B. As you can see, the diagram has this kind of like wavy pattern. It's attempting to show you that there's actually curvature here. B is what we call the superior nasal concha. And if the word concha makes you think of like a conch shell, that's because that's exactly how it's structured. It's structured like a conch shell. That bone there spirals in, and what that allows is whenever you inhale through your nose, the air as it makes its way into the nasal cavity is going to be directed through those concha. It's going to cause it to spiral and swirl through the cavity, and as it swirls through the cavity, it's going to pick up moisture from the mucus, and it's going to be warmed and humidified before it makes its way to your lungs. Just below that, we have our middle nasal concha, which has the same job. And then D is going to be our inferior nasal concha. Okay. And then again, just like our last diagram, here we have our hard palate. And our soft palate. As we look to the respiratory epithelium, the first part here at the top, I think we're all familiar with the fact that we have mucus in our nasal cavity, so that is going to be the mucus sheet. And just below it we have cilia. These cilia are going to be good for circulation and surface area. Now, I'm going to outline these because they're not really shown very well. This here is actually a cell that's going to secrete mucus. So these are going to make sure that we continuously have production of mucus, and these are called goblet cells. And these are going to be kind of interspersed with the epithelial cells, which I'm going to kind of outline here. So these are our epithelial cells in between, all of which of course have different nuclei there. And then the section of this layer of cells, of both goblet cells and epithelial cells, where it comes into contact with the bony portion of the cavity, this is what we call the basement membrane. that's it for that. Okay? All right, I know we've got quite a few diagrams for this unit. Let's just keep on going. This one here is a coronal view of our nasal concha, and they've also thrown in a bit of the larynx here as well. So let's go ahead and start up with A. We have our sinuses. Okay, so we've got our frontal and nasal sinuses being shown. B, we're looking at our superior nasal concha, which we spoke about in our last diagram. For C, we have our middle nasal concha. And I'm going to jump down to E, which is our inferior nasal concha. Separating our left and right conchas, we have our septal cartilage, and I'm not particularly sure why this was included, but it was. If you were to cut off, I guess you were to go deeper into the nose, kind of cut off the front part of the maxilla, you would get to the hard palate. And then, as we already know, again, the nostrils here are the external nares. If we look down to the larynx portion of this diagram, we're going to start off with H, which is our thyroid cartilage. Now this looks like it's a bit of a cross section or a frontal section of it. I is what we refer to as the vocal fold. We then have our cricoid cartilage, and then we move down into the larynx. Oh, excuse me. We move down into the trachea. All right, so speaking of trachea, let's move on to the larynx and trachea. All right, so what I like about this diagram is this is actually showing us the anterior and then a mid-sagittal view as well. So you kind of get the best of both worlds here. To start off, we have A, which is the epiglottis. The epiglottis serves a very important function. It's essentially going to block the trachea as you swallow anything into the esophagus. So as you are ingesting food, because keep in mind the pharynx is a shared portion of your throat that's both digestive and respiratory. Once food passes through that pharynx, it needs to make its way into the esophagus. And so the epiglottis is going to cover the opening of your larynx and prevent food from going into the respiratory tract. This is also why if food does get into that area, it causes you to forcefully cough to try and get the food out of there so that it can be redirected into the esophagus. B is showing your hyoid bone. And then C is our thyroid cartilage. What's not visible from an anterior view but is through the mid-sagittal is this cartilage here. This is the corniculate cartilage. Hopefully you can read my handwriting here. We then have this area here. You can see where it's kind of showing texture. This is our vestibular fold. And then just below it, at F, we have our vocal fold. And our vocal fold is going to be like our vocal cord. We then have our arytenoid cartilage, which is, I'm going to color it in here. And then below that at H, we have the conus elasticus. Okay. And your conus elasticus is going to be the tissue that's going to connect your vocal cords to the surrounding cartilage. It's kind of like where they're going to be stabilized. And then we've got our cricothyroid ligament. This is let me fix that handwriting there. This is going to be the ligament that connects our cricoid cartilage to our thyroid cartilage. And so J is just showing our cricoid cartilage. And then once we hit the cricoid, we've kind of hit the end of the larynx, where we are then going to move into the trachea. Oh, and then lastly, because it's not actually a structure, it's kind of just referring to the open area or the hollow region of the larynx. We have the glottis. Okay, so that's kind of like the hole that the epiglottis covers over. Again, when you are swallowing, so that it's going to direct any food into the esophagus. Now that we've made it through the larynx and we've gone to the trachea, let's focus on the connection between the trachea and the bronchi. So here in this diagram, looking at A, we're just talking about the trachea in general. It's important to notice that the trachea has multiple rings here. These are cartilage rings, and we call them tracheal rings. The tracheal rings are especially important during inhalation because they're going to prevent any collapse of the trachea. It's almost like if you've tried to use a straw with like a really thick milkshake, and when you go to inhale, it causes the straw to kind of like collapse inward and you can't get anything through the straw. Same thing would happen with inhalation. If we didn't have those tracheal rings, it would cause the trachea to close, which would defeat its purpose because then we wouldn't be able to get any air into our lungs. From there, we have our bronchi. We have our right primary bronchus. Nope, this is the left side. My apologies. Left primary bronchus. And our right is over here. And the region that is going to separate, or I guess where we're going to branch off going from the trachea to the bronchus, is called the carina. So that's kind of like the fork in the road. And then again, just to show you, see right here, you can see how thick the tracheal rings are. Now the tracheal rings don't go all the way around though. We're actually going to have a little bit of space. Sorry, just writing there. Because if we are swallowing food, we want to have room for the esophagus to be able to move. And so that's what this is here. This is tracheal muscle here. And it's going to allow a little bit of leeway for the esophagus if necessary. Okay. Let's go ahead and talk about the membranes as well as the lungs. I said earlier on that we've got a double membrane here around the lungs and fluid in between. Again, that's going to allow movement and it's going to prevent any friction. So to start off, the membrane that's going to line your thoracic cavity is the parietal pleura. Messed that up, sorry. And then the lining that connects to the lungs is our visceral pleura. And again, depending on the source of literature, they might also refer to it as the pulmonary pleura. You're welcome to say either. You'll notice that the right lung has 3 lobes, whereas the left lung only has 2. That's because the left lung is going to have a space that's going to accommodate the apex of the heart, so it has a little less room than the right side. So for the right side, our 3 lobes are going to be superior, middle, and inferior. And then on our left lung, we're just going to have superior and inferior. And again, the left lung is only going to have two lobes because of where the apex kind of cuts into the lung, and that region is what we call the cardiac notch, which is represented by F. And you'll see at the bottom here we have a diagram that's going to kind of simplify this. Not really sure why they chose to include the trachea in this section, but why not? So again, lining the thoracic cavity, we have the parietal pleura. Directly against the lung, we have our visceral pleura. And then in between there, we have the pleural cavity. Okay. Now when it comes to oxygen, or I guess air in general, making its way into the lungs, we've talked about going from the trachea, splitting to the bronchus and getting to the lungs, but we haven't talked specifically about the different branches off of the bronchi, and then down to the alveoli. So that's what we're going to go ahead and talk about in this final diagram here. So this is where some more of our physiology is going to come into play. So again, to prevent collapse, we're going to have cartilage rings. So this is just cartilage here. And then once you branch off of, I'm going to label this even though it's not, this here is our primary bronchus. Once you branch off of primary, you essentially just count how many branches you have. So once you branch off, this first one, B, is our secondary bronchus. C is going to be our tertiary. And then from there, we refer to them as bronchioles. And then once you get to the end of the bronchiole, you're going to end at this kind of bulbous sac that we refer to as an alveoli, or an alveolar sac. Okay. Oh, sorry, I just realized I skipped D. Because we're looking at primary, secondary, and tertiary, we refer to them as bronchi. Okay. And so for the last bit of our respiratory diagrams, we're just going to talk about these alveolar sacs. When we're looking at G, this is showing our capillaries. We also have what are called alveolar cells, or septal cells. I tend to say septal cells, so that's what I'm going to label it as. The actual sac region is the alveolus, if you're talking about one. And then, I'm not sure if you can see it. I'm going to go ahead and just try and draw it myself. We have this dashed line here. Again, just like when it comes to the pleural cavity having fluid, when it comes to friction, the alveoli are going to kind of inflate and deflate based on inhalation and exhalation. We don't want friction here. So we're going to have kind of a secretion that we call surfactant. That's going to line our alveolus. And that surfactant is going to do pretty much the same thing as the fluid in that pleural cavity. It's going to prevent friction. And then lastly, in this one we have, as these are the capillaries, each little individual guy here is a red blood cell, which I'm just going to label as RBC. Okay. It's important that these alveoli are covered with capillaries because the alveoli are going to be one layer of cells thick as our capillaries. Because those capillaries are carrying the red blood cells, we can easily have oxygen diffuse into the capillaries from the alveolus when you inhale. And then you're also going to have carbon dioxide diffuse from the capillary into the alveolus so that the carbon dioxide can be exhaled. And another way we can look at that is in this final diagram here. So again, we have our capillaries. These are kind of encasing each of the little alveolar sacs. Leading to each sac going from our bronchioles, we have what's called an alveolar duct. But as you can see here, looking at L and N, L is going in, so blood coming in is going to be our pulmonary arteries. We're going to go just like the pathway for, or I guess I should say the hierarchy for blood vessels. We're going to go artery, arterial, capillary. At our capillaries, we're going to have diffusion. Again, oxygen is going to diffuse into the red blood cells. CO2 is going to diffuse out of the blood and into the alveolar sacs for exhalation. And then the oxygen-rich blood is going to leave the lungs through the pulmonary vein. And that's it. Sorry guys, I know that was a lot. But if you have any questions, let me know. And that essentially covers respiratory.